Welcome to Get The PHCHA, Conversations and Collective Impact. My name is Tameka Gray, and I'm the Executive Director at the Park Heights Community Health Alliance. This space highlights the people and partnerships shaping community health right here in Baltimore. Along with simple mindfulness tools, we support real-life well-being. Today, I'm joined by Anaiyah Morgan from the Baltimore City Health Department. She's here to talk about the Healthy Heart Ambassador Program and the power of community-based prevention. Welcome, Anaiyah.
Hi.
It's so good to have you here with us today.
Thank you for having me.
Absolutely. So let's get right into it. For those who may be meeting you for the first time, tell us a little bit about yourself and your role at the Baltimore City Health Department.
Absolutely. So I have a background in public health. And public health is pretty much centered around figuring out how our health outcomes are impacted based on where we live, where we work, where we may worship, and how those factors pretty much tie into our overall health outcomes. Okay. And currently I am with the City Health Department serving as our program coordinator for our Healthy Heart Ambassador program. So that program is pretty much centered around targeting our chronic disease burden within Baltimore City. When it comes to public health, I feel like what really drew me in was the idea of health equity and making sure that despite the different circumstances, so basically where we work at, where we possibly live, we all have the same what's the word that I'm looking for? The same opportunities to thrive in our health outcomes. So to me, basically being able to be part of community initiatives to make sure that we all have the same access to resources, the same access to sustaining our health. So basically with public health, I feel like what pretty much drew me into it was having that placement within our communities where we can be trusted and contribute to our current chronic disease burdens with high blood pressure.
What does community health look like on the ground in Baltimore City?
Absolutely. Yeah. So I feel like community health in Baltimore City looks like different partnerships with all types of organizations and making sure that they are everywhere. So when we talk about our community organizations being in our churches, being in our community centers, being right in the center where our communities can have that initial access to be able to take advantage of those resources.
I love that because it does seem like there's a sectioning happening, right? And you go here and you don't see this, but if you go everywhere or anywhere and see health, or public health being talked about, or resources being offered, that is a great way, to target the population. Can you share an overview of the Healthy Heart Ambassador program that will be coming right here to Park Heights Community Health Alliance?
Yes, absolutely.
Did you sign up?
Yes. So our Healthy Heart Ambassador program is a program that is targeting, again, our high blood pressure rates in the city, right? So when we talk about high blood pressure, we're also talking about heart disease. Heart disease is still the number one factor within the U.S. that is a cause of death. So when we talk about high blood pressure management, we're also talking about that burden. So we're here, February, Heart Month. So we are promoting that program to basically help our community members control their blood pressure through tracking. So they get a blood pressure cuff if they need it, so that they are knowing where their numbers are. So when we talk about high blood pressure, the problem is that numbers are too high and then we don't realize it because we don't know where our numbers are. So this program is pretty much mediating that gap to make sure that consistently tracking that blood pressure will help us to effectively know where our numbers are and then help with us making the adjustments as needed within maybe behavioral changes with our eating habits or how we exercise. So that's another thing. This is more so a behavioral change type of program. So it's not something that you want to automatically just change everything in one setting, because that's not really realistic. But the goal is to equip our participants with the tools necessary so that they can track their blood pressure and have smaller changes that will make bigger impacts. And that may look like possibly reading nutrition labels. So maybe they're tracking how much sodium they are eating throughout maybe one day during the week, and then they dedicate that one day to not overeating too much sodium. So another component of the program, so it is bi-weekly, so we're on a bi-weekly schedule. It's 4 months. And each session is designed to teach our participants about the outstanding factors that also contribute to our blood pressure outside of, your sodium. So we also talk about a little bit with exercise, physical activity, and how that plays a role. We go over and cover our nutrition labels, how to read a nutrition label, because a lot of times if you don't understand how to read it, of course, you're not going to know what outcomes may be associated with that nutrition label. So that's an important key factor. Exercise, again, as I mentioned, and tracking is really the biggest component of the program, as tracking anything we have known has helped us to basically be aligned and know where we are. So even outside of high blood pressure, if we talk about other things that we track outside of high blood pressure, some people may say, hey, I track what kind of medications I need to be taking. So then at that point they're saying, okay, well, if I don't track that medication, then, there are consequences that happen with not taking that blood pressure medicine or whatever kind of medicine. So basically tracking has been proven, it's evidence-based and proven to work when it comes to making sure that we are living healthy and sustainable lives.
Excellent. Yeah. I can definitely see how tracking helps. I've been tracking, like at one point I was tracking, what I was eating, and I didn't even realize, because, we think that we remember everything.
Definitely.
And we really don't.
It's true. It's very true.
So let me ask you this. Who is the program designed for?
So our program is going to be designed for our adults who are 18 years or older.
Okay.
And you do have to have high blood pressure, because this program is more so for management. So we are targeting our individuals who do have high blood pressure and are looking to learn how to manage it effectively.
Okay, excellent. All right, so y'all got that? You have to be over 18 and currently have high blood pressure.
Yes.
All right. Some of the most common challenges that you see in this type of work.
Absolutely. So I feel like most barriers are associated with our food access. So oftentimes we don't have the adequate access to healthier fruits, healthier vegetables, which are basically what we want to promote with our communities, to make sure that they are adhering to, like, for example, the DASH diet. But a lot of times, a lot of our participants or community members may not have access to that. Another barrier may be not having access to care. So maybe not having a primary care provider or someone that they can go to. And our program does do a good job with bridging that through our social determinants of health screening. And that screening is a tool that's used to connect those participants with those services.
What's the DASH diet? What's that about?
So DASH stands for Dietary Approaches to Stop Hypertension. And that diet is targeting basically higher fruits and vegetables, an increase in our proteins from our poultry, eliminating our red beets. So it's primarily an emphasis on reducing salt. And that dietary guideline was based on evidence-based research that showed a decrease in high blood pressure based on adhering to that diet.
Oh, okay, excellent. Were they tracking exercising in that study, or
They
was it
were
just
not.
diet?
It was just the diet. Yep.
Interesting.
Yeah.
Is there a moment or experience that really affirmed why this work matters to you?
I really love being able to work with individuals that, get to the end of the program and then they realize, like, I really did not know all of this stuff. And I didn't realize how much it was impacting my health. And then also seeing that portrayed in households, right? So when we talk about generations and setting that example for the future generations to come, right? So when we talk about parents, so them making those lifestyle changes so that they can have a healthier heart and manage their blood pressure correctly, right? So then when we talk about the households and the children are also going to follow that lead, right?
That's true.
So when it comes to, making one person successful, I think about it in a generational aspect. So I think about it as, this person has succeeded and they have, found this work to be helpful. And then it's also going to pass along to the future generations to come. So I feel like that has really, really been the heart of my work and how I have really fell in love with it, is really seeing the impact that it has on our communities as well.
Yeah, like that domino effect.
Yes,
that's beautiful.
Absolutely.
Very fulfilling.
Yes.
Because you talk about the partnerships and how, making your presence known by partnering with people who are already, community facing.
Absolutely.
So why are partnerships with trusted community organizations like us here at the Park Heights Community Health Alliance, why are we so important to this work?
Yes. So I feel like partnerships are really, they are like the icon for public health work, right? And I feel this way because they have already built the trust and the relationships with our communities, right? So when it comes to us as public health workers trying to get in those communities and make sure that they have access to these resources, the partnerships is what primarily keeps it going and helps sustain it. Just based on that trust being built and the communities already being involved with that partner organization, if that makes sense.
It does, yeah, absolutely. It's not like a one and done. They were here and now they're gone.
Yes.
Oh. If someone is listening and thinking, I want to take better care of my heart, but they don't know where to start, what would you say to them?
So I would say that it's not easy. When we talk about behavioral change, right? Behavioral change is something that does not happen quick. When we think about any type of behavior change, it's not going to happen in an instant. But what really, really matters is starting small. Small changes make very, very big impacts. So you want to make sure that, you make the small necessary changes, and then you'll look up and then you'll be like, wow, like I'm already doing this, that, and the third, right? So I feel like that's very important. So making sure that you understand that small changes make big impacts, and also making sure that you have an accountability partner or someone that can be on this journey with you. Oftentimes I see a lot of, like a husband and a wife who'll join the class together, and it helps to keep them on track. So it may be a family member that helps you. And then you also have lifestyle coaches or healthy heart ambassadors like myself who are also there as well to help you on your journey. So I feel like the main thing is small steps make big impacts. So you want to make sure that you don't try to do it all in one setting and kind of just build upon your initial start.
Yeah, that makes perfect sense. So I love that accountability piece. It's so helpful.
Absolutely.
How can community members stay involved beyond attending the session?
Absolutely.
Yeah.
So within the program, we do stay connected. So even once the program ends, they are still able to still reach out to group members or reach out to myself. And again, when we talk about that accountability and building those partnerships, right? Within our classes, we are I like to say like a family. So we kind of all have that type of relationship where we're there to help each other, right? So that's the option. Within the class as well, I really emphasize our participants to become Healthy Heart Ambassadors. So basically finding the training necessary to be able to do this work as well. I feel like when we have our community members who are actually involved in this work, it has a bigger impact as well. Because they have the lived experience with their participation in the program and actually going through the process, which I feel like translates very well to new incoming participants of the program. So that would also be something that would be helpful as well.
Excellent. I love that empowerment piece. I'm doing this and you could do this too.
Absolutely.
You've answered so many questions about this Healthy Heart Ambassador program, but we do have the free info session coming up. If someone is looking to maybe sign up for that or they've already signed up, what could they look forward to when they spend that time with you in person here?
Absolutely. So we will, it's informal, so we are not super class structured. It's more so about building our knowledge, building our relationships to ask questions and feel comfortable in doing so. Cooking demonstrations, so to kind of bring in more of a visual for the visual learners like myself.
At the free info session or during the
program?
Oh, okay.
Wait, was this question about?
Yeah, but it's fine.
I'm so sorry. I'm so sorry.
It's okay.
So the free info session. So with that session, we will cover more about the program. So the informational session will cover the topics that we will talk about in the classes. It'll give some time for our participants to ask more questions, direct questions that they may have that I may not have covered. We'll also talk more about the program structure, so how it's structured, how it benefits them, because we always want to know what the benefit for us is, right?
This is true.
Yes. So we'll talk more about that. And then, of course, there'll be like a Q&A where we'll have an open discussion about any questions that they have as well.
Okay. All right. Well, you definitely piqued my interest when you mentioned food.
Yes.
So, and I had stopped you from that point. But was there something else you wanted to share about the possibility of a food demo?
So I'm really thinking about bringing in the food demonstrations to the classes. I think it would be very, very helpful in terms of understanding our own food preparation. Because that's an important aspect to managing high blood pressure, is making sure that we are learning and knowing how to cook and prep food for ourselves to manage our blood pressure effectively. So I'm hoping to have something soon within our classes.
Nice.
So I think that that'll be really helpful to kind of see what that may look like at home.
Yes, that will be great. Just have to let you know, as you were talking, it reminded me, I went to this restaurant. I had never been there. I tried it for the first time, and I was getting the smothered turkey wings, rice and collard greens. I was looking so forward to this, and it was so salty. I just wanted to go back and say, hey, salt's not a spice.
Yes.
So
absolutely.
I think that cooking demo would be very well received.
Absolutely.
Yes.
And that's really a good point too, because I feel like within our community we are very season heavy. So I think that also within those cooking demonstrations, I would love to kind of touch on the herbs and the spices as an alternative to our seasonings, to kind of give a feel for how flavor can still be there without the extra salt involved.
Yes,
I
please
think that
do.
would definitely be great.
Excellent. Yes. What excites you most about Baltimore City and the way it's moving as far as health is concerned?
Yes. So I am so excited for all of our ongoing partnerships, our partnerships that are really doing the groundwork to help us all achieve a common similar goal, right? To make sure that our communities thrive, to make sure that we all have health equity all across the board. So what really, really excites me is being able to see the brighter picture for our communities to be able to have the same access to resources and healthcare and food, despite where we may be living or what we may be, how we may be.
Regardless of our financial status.
Exactly. Yeah. So regardless of our employment,
right.
All of that, everyone just being able to thrive in the same space and have equal access to the same health outcomes.
Yeah, that is exciting.
Yes.
Yeah. Well, okay, so now we get to some fun questions.
Yes.
I mean, those were fun.
They were.
So informative, but yeah. So looking back, what advice would you give your younger self as you were finding your way into this work?
Yes.
Yeah.
So I feel like, being fresh in this field, right? You don't realize how difficult this work can be. The work can be very, very, very difficult. Yes, but it doesn't have to be, right? It doesn't have to be. Yes. So we have, because we've talked about our partnerships, right? We've talked about how collaborative work, it really, really helps in the long run. So I feel like I would tell my younger self to fully take into those partnerships and really build upon them, because oftentimes when you have partnerships, it's not always who you have as the partnership, it's about sometimes who they know, right?
True.
And that's how we build upon and get into different communities.
Yes.
So I feel like I would tell my younger self that, to really, really, not try to do the work on my own, because I feel like when I started out, I thought that was the way to go. And quickly I realized that the partnerships is really how you get this work done.
Yeah, that's beautiful. That's excellent advice.
Absolutely.
I could say for sure the partnerships we've had with the Park Heights Renaissance, with We Our Us, who did the food at the food drive that we collaborated on, like those partnerships have been immensely helpful in this work.
Absolutely.
And they did lighten the load. So that's great advice for your younger self.
Absolutely.
I agree. More lighter note, as we begin to close out, what's a fun fact about you that you'd like to share with us today?
Yes. So it's actually funny because before I got into the public health field, I thought that I wanted to be in business.
Okay.
So I always had a heart for community, giving, making sure that everybody had what they need. But I feel like business just wasn't for me. I felt like business, I feel like primarily what set me apart from business, because not just business, I need to clarify. So business within healthcare is what I wanted to do originally. So somewhere along the lines of like healthcare administration. So dealing with, the business side of hospital systems and organizations that deal with healthcare, right? But I felt like the business side just wasn't for me. I felt like being part of the other side of the business and being able to advocate for the other side of the business is where my heart really fell. So I felt like that was pretty interesting.
Yeah, I love that though. I feel like we definitely need to follow our heart, especially in this type of work. To be stuck doing something that you're really not that passionate about doesn't lighten the load at all.
It's true.
Well, that concludes our time for today. Is there anything else you'd like to share with us?
So our informational session will be next month. So we have our interest form out enrolling. So if you are interested in attending, please sign up.
Yes.
It will be a great time. We'll learn more about, managing our high blood pressure. So, yeah. That's all I have to say.
Okay, great. Yep, so we have the Eventbrite link is out there. You could also get the information off of our page, Park Heights Community Health Alliance on Facebook. And you could also find the link on our Instagram, which is PHCHA1. All right, and as always, you could personally reach out to me or Anaiyah. Is there any way they could contact you, an email or something?
Yes, so I can be reached by email at anaiyah.morgan@baltimorecity.gov. So if you have any questions, you can reach out to me directly by email.
Excellent. And if you have a space and you're willing to host a Healthy Heart Ambassador program, they would love to hear from you as well.
Absolutely.
Yeah. So thank you again so much for joining me today.
Yes,
always
thank you
a
for
pleasure.
having me. Yes.
All right, and until next time, get the picture.